Hello everyone, my name is Jeffrey Truong, and I will be presenting to you my thesis research titled Mental Health Burden Among College Students During COVID-19 Pandemic, a cross-sectional study. So to start us off, why are we even concerned about COVID-19 and its effects on mental health? Well, as many of you probably already know, the COVID-19 pandemic has been a significant public health issue that has negatively impacted both the physical and mental health of many. In terms of mental health illness, however, prior to the pandemic, there were already concerns of increased prevalence of mental health illness and not enough resources to address such. College students in particular are exposed to a unique set of circumstances and expectations, which place them at much higher risk for developing mental health illness. Examples of such include the pressure to perform well academically or being the first child to attend college in the family. Additionally, various social determinants of health, such as ethnicity, can further worsen mental health status. Hispanics or Latino students in particular have been found in previous research to be more likely discriminated upon, which was attributed to increased stress levels and poorer mental health outcomes compared with other ethnicities. To further elucidate the association between college students, COVID-19, and discrimination, this study was designed to evaluate the burden of the COVID-19 pandemic on the mental health outcomes of college students, with a sub-focus on its role in experiences of discrimination and academic performance. The data was collected utilizing an anonymous virtual survey from college students who were at least 18 years of age. And to prevent the effects of self-selection bias, broad inclusion criteria and diversity of students from multiple departments and majors were utilized. Additionally, to avoid potential identification of participants, a random sample of 98 participants was used. This study also utilized a cross-sectional approach. The variables of interest in this study were mental health, COVID-19 symptoms or diagnosis, COVID-19 isolation, ethnicity, experiences of discrimination, and academic performance. And to analyze all our data, we utilized SPSS version 28 by IBM Corporation, and we ran descriptive and bivariate statistical analyses with a p-value less than 0.05 as our standard for significance. This study was also approved by the Institutional Review Board of Cal State San Bernardino. Now here in the results section, all the percentages denoted with an asterisk indicate significant values with p less than 0.05. In the first table here, we see the percentages of participants who reported experiences related to different variables. All these results were found to be significant. In the second table here, we see a cross-tabulation involving Hispanics or Latinos and other ethnicities denoted as non-Hispanic Latinos. Despite different variables tested here on the left column, all results were higher in the Hispanic or Latino population when compared to the other ethnicities. Of note, however, the last variable involving mental health worsening due to COVID-19 symptoms or diagnosis was found to not be significant, which might indicate the need for a bigger sample size. And in the bar graph here, we can see a significantly higher percentage, almost 4 times as many participants who reported both average, poor, or very poor mental health and worsening of mental health due to COVID-19 related isolation. In comparison, only 12.2% of people with reported excellent or good mental health status also reported worsened mental health due to COVID-19 related isolation. In conclusion, there was a significant association between COVID-19 related discrimination and the worsening of mental health. Additionally, there was indication that health disparities exist among the Hispanic or Latino population that disproportionately affects their mental health more than other ethnicities. Independent of ethnicity, however, COVID-19 was shown to have negatively burdened the mental health of college students in general. The implications of this research should indicate to both public health and academic institutions to prioritize populations disproportionately affected by health disparities to optimize their wellness and academic performance. And to close out my presentation, I would like to sincerely thank the Office of Student Research for both hosting this symposium and providing grant support. Thank you everyone for tuning in and learning about my research. Have a great day!